Well, I decided to work in a care home because of the privilege of that continuity of care. I get the opportunity to work with the residents for a long time, so we get to sustain that health journey. It could be 5, 7, or even 12 years that we're accompanying that person along their journey. So for me, that's a privilege.
I never really wanted to work in a care home. I always wanted to work in a hospital. So it was going to be a temporary job, but then 10 years down the line, I'm still here. And I love it. And I can't see myself going anytime soon. What I like about it here is that you've built that rapport with the relatives and the residents. So it is like a family.
Here it's more relaxed. I don't have the stress I have when I used to work in hospital.
I always looked down on nurses working in nursing homes, thinking,
Can't do anything else.
they can't be a very good nurse. They're just looking after old people in a care home. But then it came to the point when I was a single parent and hospital hours were no good for me. So I applied for a job at a nursing home. I've never gone back to the NHS. I've worked in nursing homes since. Completely different. You get to know your resident, the person, their life, their history,
I agree.
and following them through.
I agree completely.
I've worked in quite a few hospitals over the years, and for the last 20 years I've worked in care homes. I find that in care homes it's a lot more relaxed, it's a lot more choice for the individual really. We go by how they want to live their day. They can be more themselves. You don't feel so pressured, so scrutinised. You have that relationship constant every single day. So you get to know them really well and it gets a lot more personal. You're more like their friend, really, and somebody that they can rely on. The most important thing is how you look after the people that you're caring for.
I have a chance to see them like on a daily basis, day after day. Have a chance to interact with them to understand what their care needs are. So it makes it easy for continuity of care. Everything is provided. The support that you get for your NMC registration so that you feel very, very confident to start working as a nurse. Even when you're working on your own, you feel very, very confident. Coming here to work for Shaw Healthcare, I think is the best decision that I've made. They've nurtured my abilities and they've helped me to grow as an individual to be the best that I can be.
We've all got different levels of experience and knowledge, but we share that. We've got general nurses, we've got mental health nurses, we have had learning disability nurses,
yeah.
and we all share our knowledge. If there's some general nursing advice,
absolutely.
she needs to know, she'll come to me or one of the other
Absolutely.
nurses. We share, we support.
Well, we have to support, don't we?
Yeah.
Because we haven't got a doctor on call. We haven't got a button to press and a doctor comes running. We have to make decisions all the time, especially towards end of lives and things like that. We have to make important family decisions.
The pay is a lot better, it's a lot fairer. You're paid for what you're qualified to do and what you do on a daily basis. The NHS, the workload is quite heavy. The breaks are really strict. For me, after sort of 20 years, I'm more comfortable working in a more relaxed environment. It took me 6 months to get a job with the NHS, and here they're very, very quick at going through the application process, the DBS, they'll explain everything for you, they pay for that. You know, nothing seems to have been too much trouble, really.
Considering my own experience, as well as what I hear from my colleagues who are working for other companies, Shaw Healthcare is the best company to come and work for. I've really done well for myself, and I can see that there are lots of opportunities within the company. If I'm willing, I can climb up the ladder. So that's the great thing about this company, really.
Just get in contact with the recruitment team, basically. Reach out to other nurses that work for Shaw.
Come and have a look, come and have a walk around, come and meet the people that are there, come and see the kind of people that you're going to be looking after.
It is the team.
The team and the love we can give to the people. It's real care and a real... I've never had anything like that anywhere else.
If they want to retain nurses, you've got to look after them. you know, we're not two a penny anymore, are we?